One of the most important techniques that a physician can employ when establishing the diagnosis is simply giving the patient a chance to talk. We call this reflective listening. In essence, we're encouraging the patient to tell their story. We're all too often eager to interrupt the patient. Oftentimes we interrupt the patient 17 to 23 seconds in the course of an interview. We barely have a chance to see what the patient is there for. We think that the patient is going to talk for days. In reality, if we don't interrupt the patient, studies indicate that the patient will usually speak for at the maximum 90 seconds. By interrupting the patient, we're breaking their train of thought. All too often, the patient may present with a chief concern, but that concern is not necessarily the first thing the patient expresses to us. Sometimes we need to encourage the patient to talk about why they're there. We can oftentimes say, "Go on, tell me more." By pausing, the patient has a chance to say why they're really at the visit. By improving the chance for the patient to communicate with us, we're much more effective in providing a diagnosis. As we're giving the patient a chance to talk more effectively about their concerns and their worries, we will have fewer and fewer of what we call doorknob questions. That is simply the possibility that as we're exiting the exam room, the patient will have one more concern or one more worry. That will sometimes cause us to restart the whole exam process and the interview process from where we started. By giving the patient a chance to express their concerns, we're listening effectively. Sometimes we can encourage them to tell their story by nodding our head, by saying, "Go on," by simply saying, "Tell me more." As we find out why the patient is there, we can fill in the blanks and have a better idea how to help the patients.